Patients impacted by the diagnosis of Duchenne muscular dystrophy require multidisciplinary management. And this is because dystrophin impacts muscles throughout the body. And lack of dystrophin in the muscles throughout the body impacts the ability of those muscles to be able to function at their typical capacity. So we see weakness in the arms and legs. We ultimately see weakness of the respiratory muscles, and we see impact as well to the cardiac muscles. In addition, we can't forget about the muscles that allow us to do things like chew and swallow, and those that impact bowel and bladder habits. So it really requires a comprehensive team to be able to care for the patient with Duchenne muscular dystrophy. In my multidisciplinary neuromuscular clinic, we have a neuromuscular specialist, which is myself. We typically also have a physiatrist, a physical medicine and rehabilitation physician that helps us to be able to make recommendations to provide accommodations to the patient so that they can pursue activities of daily living to their best ability. This may include devices such as wheelchairs, transfer boards, bath chairs, braces, and they help to guide some of the therapies that we prescribe as well. In addition, we typically have a physical therapist and an occupational therapist who provide evaluation and support to our patients. The physical therapist traditionally performs some routine standardized testing at each visit that allows us to be able to track the progress of the patient. And this helps if we start to see a decline in function for us to know that it's time to make some changes in our recommendations for supportive care. Our occupational therapist also helps provide some assessments that permit us to utilize those results to guide accommodations at home or at school. In addition to those specialists, we also have a pulmonologist that helps to keep our lung function optimized. And when we start to see that the respiratory muscles are impacted, we intervene with things such as cough assist devices. Sometimes we utilize a vest to help loosen secretions. And ultimately, we end up utilizing devices to help support respiration, like a bilevel support device or BiPAP device. In addition, we involve our cardiology specialists. They routinely provide assessments through EKGs and echocardiograms, as well as potentially cardiac MRIs that allow them to guide recommendations for medication management to help optimize the heart function. In addition to those specialists, we utilize an educational liaison sometimes to help communicate with the schools, particularly for those patients who are younger and might need accommodations within the school system. We also enlist the help of a dietitian to help guide recommendations to optimize nutrition for these patients. We know that their nutritional needs may actually change as they reach certain degrees of weakness that limit their mobility and then change their metabolism. And then we also utilize the help of our social workers, both from a perspective of navigating the medical system and also dealing with the emotions that come along with being different than one's peers. So we have a comprehensive multidisciplinary group that facilitates the care of our patients, and we sometimes stretch beyond that typical and traditional multidisciplinary group, relying occasionally on our surgeons if we need them, like our orthopedic surgeons as well.
So the multidisciplinary team for the care of patients with Duchenne's muscular dystrophy tend to have the same structure, but that structure may vary from site to site. When thinking about the medical specialists that that child or adult would encounter, this would include a neurologist, a physiatrist, a rehab doctor, a cardiologist, a pulmonologist, an orthopedist, as well as an endocrinologist. And majority of the time, all of those specialists are in the clinic working together at one time to help to support the patient, helping to decide surgeries, helping decide next best steps in general. And then we have additional supports. So a speech therapist may help with that child with eating and monitoring eating to make sure that there's no difficulty with swallowing. They'll work closely with a nutritionist to monitor weight and growth. The standard of care for boys with Duchenne's is using steroids. And so this has a big impact on weight gain and a big impact on growth in general, and can also cause other problems like adrenal insufficiency or delayed puberty. So a nutritionist working together with the endocrinologist can help to monitor these parameters. The social worker is a vital component of any multidisciplinary clinic. They help us with understanding psychosocial supports, understanding how the child will make certain transitions. Are they ready to make that transition? Additionally, an educational specialist is vital because they're the liaison to school and providing school supports, letters that will help to establish 504 plans or individualized education plans that are, ideally fitted for that particular patient. There can be additional ancillary services outside, including parental or family support organizations, the identifying an ophthalmologist and a primary care doctor who are comfortable with multiple specialists is also important. So it takes a village. My nurse coordinator describes our weekly clinics as a wedding to put it all together, but it's the best care for the patients with Duchenne's muscular dystrophy.